So without further ado, our Budget Director, Tim Keene.
Well, once again, a difficult act to follow. I need to get moved on these programs farther away from when you're speaking. Good afternoon. Welcome to the unveiling of Governor Kasich's FY12 and FY13 biennial budget. What I'm going to do today is give you some overview remarks and broad overview of what's in the bill. We'll have then some other speakers who follow me that will talk about a lot of the impacts on their agencies and some of the particular reform elements. And then we'll be able to take your questions at that time. You know, before I get into the presentation itself, I just have to say a word about the team at the Office of Budget Management, the budget analysts, the support staff, the IT people, and my assistant director, Chris Whistler, who was in the room. This budget would not have been possible without all the hard work that they have put in and to allow me to stand up here and talk about this today. The governor has had a vision for how he wants to lead the state of Ohio. Consistent with that vision, there are some budget principles that we use to develop this budget. The first of those is that the budget is a means to an end, not an end in and of itself. The end is economic development, economic competitiveness, and job growth, making us more competitive not only in this country but throughout the world, making us an attractive place to do business, grow jobs. Another objective is to eliminate the structural imbalance and return Ohio to a firm financial footing. We have known for 2 years, since Mary Taylor warned of this significant structural imbalance in the current budget framework, that this day was in fact coming. $8 billion, just shy of $8 billion, Auditor Taylor's analysis revealed. Let me tell you, that is the right number. I will tell you that $8 billion is the right number. If you project what spending would have been without law changes, and you compare that to the expected revenue without law changes, you get an $8 billion gap over this biennium, about $4 billion per year. Over the last 9 weeks, what we have done is work to close that, and we have succeeded. Review all spending, another priority. We wanted to go in and look at all of state government, every program, agency, line item. Carefully review what the appropriate funding levels are, what programs, where we needed to put additional resources, where reductions would be possible, and we've done that. Reform and restructure state government. I tell you, budgets are about numbers, they're all about policy, but in this budget, the reform elements are just critical. They are integral to the success of this budget, because given the reduced resources that are available to state agencies and to local governments, it is many of these reform proposals that you'll hear about today that make this budget possible for state government and local government to move ahead. And lastly, and most importantly, preserve the social safety net for Ohioans' most vulnerable citizens. And I think we've clearly succeeded in that regard. I mean, if you peruse the appropriation levels, the recommended funding levels for the various agencies, you will not see the draconian cuts, the devastating cuts that so many of you have been predicting all this time. And a lot of that is because of the process and the viewpoint that we brought to bear in this budget. So what about the budget environment? We all know that we have a fragile economic recovery in place, both at the national and at the state level. We have been in recovery for some time, but it's unsatisfying. Sluggish, unemployment too high, growth really too low. And so that's an environment within which we have to operate and consider as we put together this budget. We think we've taken that into account and managed that. Frankly, there's been a history of avoiding hard choices. Clearly in the last 2 years, the difficult choice is to put the state in structural balance and to make the necessary long-term reforms to put the state on a firm footing were put off. But frankly, it's longer than that period of time. There are so many programs and areas of spending, entrenched interests that previous leaders have not been willing to take on, that this governor is willing to take on. We've been able to do that, get in there, and make many of the important changes. You know, I've talked about the significant structural imbalance. It was there. It was a clear element of challenge. And the excessive reliance on one-time revenue. Again, we're all familiar with this. Here's the chart from the Budget and Planning Commission report from late last year that outlines the numerous one-time resources that were used to prop up the current budget structure. I'm not going to go through it, but we'd be here till 5 o'clock. Significant one-time federal money, significant one-time state money that is just no longer available to us. So now we have the executive budget to you today. March 15th is required by statute for the new governor. As I mentioned, a balanced budget, structurally balanced, significant reform package for the next 2 years. This budget it's now posted on our website. Perhaps many of you have seen it, available for your review. In addition, we have some other documents that are or will be available to supplement and analyze this, including, I think, was distributed to you today, a budget summary document that has some key tables and other summary information for your review. So what are the budget highlights? Again, closes the structural imbalance without raising taxes. Return us in the second year to the place where our ongoing revenues and our ongoing expenditures are matched. There is essentially no one-time money in the second year of this budget. We are absolutely structurally balanced, setting the stage for us to move forward and tackle additional challenges as we face them. We have preserved the $800 million income tax cut that went into effect on July 1 of this year for Ohioans. We have increased state GRF formula aid, increases by $170 million over this 2-year period of time. We have increased higher education state formula aid over the 2-year period by $62 million. Notwithstanding the other actions we had to take to balance this budget. There are significant Medicaid reforms in this bill and significant Medicaid cost containment to allow us to reduce the growth rate of Medicaid above what would otherwise occur without policy intervention. That to overcome the loss of the federal stimulus money. And in education, that is particularly important. Or, excuse me, in Medicaid, it's particularly important. Significant GRF support for education, for Medicaid, was just eliminated, shifted off the state GRF dollar and off of the GRF completely to non-GRF sources over the last several years, 3 years actually, FY9, FY10, and FY11. That federal enhanced match is gone, and so the state contribution to Medicaid is significantly higher than it was previously. 28% across the whole Medicaid program for state GRF dollars. Now, that's significantly lower than otherwise might have been, but here is a perfect example of the loss of federal stimulus and the impact that it has. And frankly, the failure to pay attention to cost containment measures over the recent past as well. I believe that this budget thoughtfully allocates limited resources. There's a lot of reductions across the GRF agencies. Most GRF agencies have less money in 12 and 13 than they did in fiscal year 11. However, it was not across the board. We carefully considered these various programs. You will see GRF line items and you'll see non-GRF line items where there are increases. And that's because in certain places we thought it made sense to allocate resources in key programs and areas. Within agencies where their budgets are reduced, for example, Department of Rehabilitation and Correction, while there are a lot of cost savings elements, there are resources allocated toward critical security-oriented programs. In the Department of Mental Health, you'll see additional resources provided to try to address some of the problems that have existed in the community mental health programs. And lastly, the budget has significant reform elements that provide cost relief for both state and local government in K-12, in higher education, in prisons, Medicaid, and local government programs. So all budgets start with an economic forecast. On February 17, The Governor's Council of Economic Advisors met. We had a good discussion about the state of the national and the U.S. economies. In addition to that, Ohio uses Global Insight, a national econometrics firm, to allow us to have global insight into some of the best thinking about the state of the economy. What we have assumed, what we were told by the Council and by Global Insight, is that we should expect a slow and sustained economic recovery driven by moderate economic growth. The U.S. GDP will stay at right about 3%, which is again much improved over what we've seen recently. Employment growth is expected to pick up in both the U.S. and Ohio over the forecast period. Projected unemployment is projected to slowly decline over this forecast period. These indicators are some of the key factors that we use in our revenue estimating models. As you all know, the General Revenue Fund is the largest single fund in the state. It's the fund where most state tax dollars are deposited and where the Governor and the General Assembly have the greatest discretion to allocate resources. This chart displays the revenues for the General Revenue Fund. As you all know, where most of the money comes from the personal income tax, sales tax, federal grants and reimbursements that are mostly attributable to the Medicaid program, and then other taxes and other resources. Total of about $27 million in General Revenue Fund revenue in fiscal year 12, which is slightly down from fiscal year 11, and then 28.7% in fiscal year 13. We believe we have conservative revenue estimates that are the basis of this budget. They are based on the economic forecasts that I just outlined. The baseline revenue estimates are in the vicinity of 2.5%. Tax revenue estimates in the vicinity of 2.5% and 4%. There are some policy changes that I'll talk to you that increase total GRF tax revenues to in the vicinity of 7% a year. On the other side of the ledger, GRF spending. As required by the state constitution, the governor's budget is balanced, and the structural imbalance has been eliminated. Total GRF spending is about $26.9 billion, which is 1.1% over fiscal year 11, and $28.6 billion in fiscal year 13, which is 6.4% above fiscal year 12. I will tell you that these general revenue fund percentage, I would not focus exclusively on those for a variety of reasons, including a lot of the policy changes that are in there, including the loss of the federal stimulus, and I'll be happy to get into that more a little bit later on. Again, where does the GRF spending go? Primary and secondary education, higher education, the Medicaid program, Department of Rehabilitation and Correction, youth services, parks, a variety of other services. It's just a slide to demonstrate the total all funds budget, and I'm showing the spending side of it here. As the governor said, the GRF is only about half of the total state budget. There are significant resources that are contained in other funds. Now, in some instances, there are restrictions on these funds, and there's not a lot of flexibility as to how we can use this. But frankly, there's actually a fair amount of the non-GRF funds that are subject to some of our policy making. And what we have tried to do was widen the field to take into consideration some of these long assumed trends on the use of some of these resources. And when you look back and say, how do you solve an $8 billion budget deficit across a $26 billion general revenue fund? You say, you just can't do that. It's impossible. My gosh, look at all the cuts you have to do. But when you stop and think about a $50 billion budget, the possibilities are greater. And frankly, that's what we've done. I said earlier that budgets are about the allocation of state resources. And of course, the policy that governs them is very important. It is in this budget more than any I have ever seen in my career. There are key reform proposals that will be absolutely critical for the future efficient and effective operation of this state and of the local governments therein, and that make changes that will allow the state and local governments to manage their way through the difficult budget that we have unveiled today. And as the governor said, I really am very excited about the budget we put together. And I shouldn't get into my conclusion yet, but I'll finish my slides. You will hear from many of the individuals in the room about some of the reform details that are contained in this budget. But again, back to the main focus of this budget, jobs. The jobs budget, transforming Ohio for job growth. How do we do that in this budget? Balancing the budget without raising taxes, making sure we maintain and improve our competitive standard so that we're attractive for business, so that jobs can be created in this state. Creating a jobs-friendly climate, preserving the income tax cut. $800 million, sending a signal that, that we understand the significance of taxes and low taxes. Dedicating resources for job creation. This bill provides a funding stream for the Jobs Ohio nonprofit corporation focused on job creation here in Ohio, and it will to do great things for the long-term future. Helping local governments reduce costs. Again, a lot of the reform package here is going to allow them to reduce their costs and adjust to the reduced revenue streams they will receive under this budget. So what's the bottom line? I think it's an outstanding package that it's the right budget for these difficult times, makes the right policy choices to have Ohio moving forward to improve our competitiveness, increase our attractiveness to business, and grow jobs for the citizens of the state.
Thank you, Tim. For members of the media, just so you know, everybody played a critical role in this. There's no way that just one person could have done this. And we have most of the cabinet impacted members here today. What I will tell you is we're going to hear from Greg Moody, who led the Office of Health Transformation. Bonnie Cantor, who is the Director of the Department of Aging, has played a critical role in terms of balancing the resource needs that we have with the independence and comfort of our seniors. She is a leader nationally in terms of being an advocate for independence and comfort for our seniors. She was part of this team. Dr. Wimslow is a pioneer in the medical home, which is an effort to coordinate care so that when your mom leaves the hospital in the wheelchair and put her in the car, we know what we're doing and where we're going. Greg will get into that. Orman Hall is our director of Odatus. I still don't know what it stands for, but no, I really do, just that was a joke. With Odatus, and as you all know about the efforts that we've made to not only to deal with the problem of prescription drug abuse, but to draw down federal monies to change the way in which we approach this terrible problem of addiction. John Martin, who is a holdover from the previous administration, the father of a developmentally disabled child, he contributed mightily to everything, and he stood there at the gate to make sure that no family was going to be left behind, and he's done it. I love the man. He's terrific. And also on that team, who am I missing? I guess I've got and John McCarthy, who came here from the District of Columbia. A critical part. He's our director of Medicaid. So he knows the ins and the outs, and he knows how to draw down federal dollars. He understands the impact on providers. I'm thrilled that John came to Ohio. He's actually going to move his family to Ohio, and he's just fantastic. So, and of course Tracy Plouk, who heads mental health. Her biggest job is to try to coordinate the integration of health, physical health with mental health. Something that people have avoided. They don't want to do it. It gets in somebody's way. but to actually coordinate and integrate physical health with mental health makes an enormous amount of difference in the way in which we treat those who are in trouble. So without any further ado, Greg Moody, who is